Hello, this video intends to take you through the testimony of Vanessa Carter, a patient who survived an antibiotic-resistant infection. Welcome.
So this was what I call my last photo opportunity before I had a major car accident in 2004. And this was in Johannesburg. I was a passenger in a car. The driver that was driving at the time, there was somebody that overtook him and on the wrong side of the road, and our car ended up going into a violent spin and impacted a concrete wall on the other side of the road. So I was taken to the Charlotte Macleay Johannesburg Academic Hospital, and I was put onto ventilating machines. I had been resuscitated on the side of the road at the time, and I was basically fighting for my life at this point in time. I had a lot of injuries, not just to my face, as you can see, but also internally, to my pelvic bones, to my abdominal area. So this is basically an outline of all the injuries. And as I say, the major abdominal injury was what they were really worried about at the time. And neck injury had an instability between the C1 and the C2, back injury, and the head injury I've highlighted in red because at this point in time, even though it wasn't the most life-threatening, it was the most complicated injuries that would lead me on to a 10-year journey beyond that. So at this point in time, this was kind of what my face looked like. And at the Johannesburg Hospital, they implanted a silicone implant, silicone ocular implant behind the muscles in the eye to give enough volume to get an artificial eye. But the bone structure was very damaged. From there, I went on and I got other implants inserted. So there was a MedPaw implant put in by an ophthalmologist. So eventually in my 6th year, I had an alloplastic implant that needed to be inserted by a maxillofacial surgeon. And this was basically to bridge the deficits that was in the bone between the nose and the cheek area. So he did the operation, he did the surgery, and I had formed adhesions to the alloplastic implant that he used. And so a plastic surgeon then had to release the adhesions in a very basic surgery after that. And literally 2 weeks later, I went shopping. I went to the store. I felt moisture falling down my face, and I wasn't too concerned about it. But when I got into my car, I pulled down the rearview mirror and I saw this pus seeping out everywhere, and I didn't quite know what to do because I'd never seen this before. I'd had other prosthetics implanted, but this was the first time that I'd seen this infection, or this fluid pus seeping out. So I phoned my plastic surgeon's offices and I said, what do I do? I was in a panic. And they said, you need to come in to the emergency department, and we'll see if we need to do a emergency surgery. Potentially it's an infection. And so we did that. And so what they did was they debrided the implant, and they did a bit of a reconstructive surgery to repair the damaged tissue under the eyelid. And I was discharged, and 2 weeks later the infection came back again. But each time I was discharged, so I was prescribed a course of antibiotics, and I would be readmitted with the same infection, that looked worse again, same sort of pus, same sort of infection, symptoms, and I would be discharged. So every 2 weeks this would be ongoing, and it wouldn't just be with my plastic surgeon; it would be with other surgeons as well. So this was the important part about the facial surgeries that I was undergoing. So it wasn't just a plastic surgeon that I was seeing. It was a plastic surgeon, maxillofacial surgeon, ENT surgeon, ophthalmologist, ocularist. Obviously the ocularist wasn't doing surgical interventions, but he was working on the artificial prosthetic, the artificial eye. And it was very fragmented care. It was very, each one was prescribing a course of antibiotics in the meantime while I waited to see the other surgeon, and each one was prescribing a course of antibiotics, as I was undergoing the surgeries, and to basically manage the infection as a whole. So there was very little communication going on between them. So this was 11 months down the line, which is a photo I call my point of no return. And I called it that because every time I looked in the mirror, and you can imagine when you look in the mirror like this, you think to yourself, how is anybody going to possibly fix this? And I could see in my doctor's eyes that they felt the same way. And when they spoke to me about it, when I'd say to them, how can you fix this? They didn't seem very hopeful. And so basically what had happened here was my plastic surgeon, who I had developed a very good relationship with by this point in time, said to me, Vanessa, I feel that this prosthetic needs to be taken out. I know that the doctor's giving you differing opinions, but I feel that if you don't take it out, this particular alloplastic implant, you're not going to get better. You're not going to get rid of this infection. And so I was in ENT surgery at that point in time, and he was working in the same hospital. And so he, when I was under anesthetic, came in and he literally did take this prosthetic out. When I woke up, this is what I looked like. This new bone structure, alloplastic implant was gone. And, so something rang alarm bells for me. I thought to myself, why has this plastic surgeon, taken this risk on his shoulders and come into surgery and done this for me? And obviously because he cared very much in terms of what was going on. So I knew that he had sent it off for testing. This is the first time that I'd heard the word testing, diagnostics. And so I phoned Lancet Laboratories in Johannesburg and I asked them, please, can you send me a copy of the test? I just want to understand what is going on. Why was this doctor so concerned? And so they sent me this test, and at the top of the test it said MRSA, a word I'd never heard of, a term I'd never heard of. Lots of R's and a few S's going down, the test results. And so of course I got curious, as any patient would be, and I started Googling it, and up came methicillin-resistant Staphylococcus aureus, and the fact that the overuse of antibiotics and things like infection prevention control and so on was literally putting my life at risk, for having this infection. So so it just freaked me out completely. I didn't understand why. I didn't know about this through all the surgeries that I was going through. So one of the things that I did, obviously I searched for information, but I also took my medical history, because what they told me at that point in time was that I couldn't go through too many more surgeries. I needed to wait out a year before they could touch the area again. And I also knew that, there wasn't a chance of me going through failed surgeries to try and complete this reconstruction that we needed to do. So in other words, I needed to get it right the first time. And so what I did was, during the year that I had to wait it out, I emailed a couple of photos and a short medical history to doctors overseas. Some of the doctors that I'd found on medical journals that were writing really important articles about facial reconstructions and, infection management. And I was very lucky at that point in time that one of them did answer me, and it was Dr. Edward J. Caddison, who was working in the face transplant team back in Boston. And he said, I see cases like yours all the time. We do facial transplants, and obviously there's a huge infection management issue there. We're very willing to give you a couple of pointers to help you find the right doctors back in South Africa, which he did. And so, he took a 3D model, a skull model in his hand, and he explained to me what I needed was a zygomatic osteotomy with minor touch-up surgeries afterwards, and I needed to basically seek out somebody that could replicate that sort of advice. And so I did. I went through Johannesburg. I found many, many doctors, many, many professors, until eventually I found Professor Johan P. Reinicker, who was situated at the Sunninghill Hospital in Johannesburg. And so we did the surgery, and the anesthetic outcome was really, really good, because he got the sort of drooping eyelid right up in terms of realigning the bone. So the osteotomy obviously means that they cut the bone and they realign it forward, and that is what needed to be done, not more foreign objects added, because it just added the risk of infection to my face, especially with other prosthetics in there. So this is kind of what my face looks like now. I mean, as you can see, I'm just kind of a walking infection prevention nightmare, with all these different prosthetics in there. I've got lots of titanium, I've got lots of silicone, I've got lots of Medpor. I did have the yellow plastic, but that was removed. So we did get, after performing the zygomatic osteotomy, we did get another infection. This time we were worried, or Professor was really worried that it was in the bone. And so he started to rotate antibiotics. The other thing that was picked up was that I potentially had an allergy, and the allergy, we think, came from Chloromex, which was the topical antibiotic ointment that I was using on the surgical site. And so we stopped that as well together. And over time, it basically cleared until eventually, this was about 3 months after that infection, that second infection, potentially in the bone, where I was able to uncover my face and, go back out into public. 10 years later, 3 years of fighting infection, 10 years of very complicated navigating the whole system and working with doctors to try and manage the facial reconstruction, and my recovery really after the car accident.
Thank you for watching.